to common eye symptoms. But today we're focusing specifically on our children. Of course, for most, it's midterm. Yes, they're resting their eyes a bit. So we're talking about the common eye symptoms in children. Right now, children in Lagos State, we talked about that. And so it's a good time for you, parents and guardians, to take them for an eye test just before the second half of the term. To help us shed light on this very crucial topic, we have with us Dr. Aruno Rashidat, a very experienced optometrist at the Modern Eye Care Foundation. Welcome, Doctor.
Thank you.
Okay.
Thank you very much, Akan. Good evening.
Okay, great. So first of all, it's been a while. I've not seen you in a bit. Hope you're good.
Yes, very good.
What happened? You decided not to...
I was on New Year break.
Oh, I thought you guys don't go on break.
I was on break at the clinic.
Okay, so Doctor, first of all, how can we tell kids with sight issues and those who don't, are there any signs? We're talking signs, talking symptoms.
Symptoms, yes.
I know last week Dr. Priscilla told us that one is objective and one is subjective.
Yeah.
But what are these symptoms?
All right, so good evening. We'll be talking about some of the common symptoms you notice in children.
Okay.
Of course, children are not left out, when it comes to the eye. They also have eyes, and their eyes are very important. Children are the future, and you want to make sure that their sight is perfect, their sight is optimal, especially for their development, in fact, for their general development. I'll tell you that if a child's sight is poor, it can even affect the esteem of that child.
Self-esteem and
Self-esteem
all that.
of that child, yeah. So it reminds me of one of my patients. So while carrying out his test, I was observing him. He has this squint. I'll talk about squints.
Okay.
So it won't look at your eyes because it's self-conscious, it's self-aware of the fact that one eye is turning inward while the other eye, so it wouldn't look direct at you. So I spoke to him. I was like, "Oh, why won't you look at me in my eyes?" He said, "It's awkward." I was like, "No."
He said so.
Yes.
Wow.
So I said, "Just..."
How old?
How old was he? He wasn't even up to 14. I think it was like 11 or 13, thereabouts. Yes. So I had to talk to him, encourage him, counsel him, tell him you should be confident. That's your confidence, okay? Don't be self-aware. At least he's at the clinic and he's getting treatment, which is good. So just spoke to him. So it goes a long way to tell you that the eyes, if it's not okay, can affect not only the child's education, can affect the child overall health or self-esteem and all, exactly. So now I'm talking about the symptoms.
Yes.
So number one symptom I have here is squint.
Squint, okay, like you just mentioned.
Like I just mentioned. So squint means strabismus or half past. Let me just go straight to what people know as half past.
Because when I hear squint, in my mind, I think it's when you do your eyes like, is that not squinting?
So that's what people...
Yes.
Yeah, that's what people know as squinting.
Yes.
But that's a different one.
Doctor's taking us to the classroom, okay?
So the squint is also known as strabismus, popularly known as half pass.
Where your eyes, you're looking,
one of your
you're looking somewhere else.
Yes, you're looking straight at someone, and then your eyes looks like, or one of the eye is looking elsewhere, either turning inward or turning outward. That's what's called squint. Okay, and it could result. It has several causes. One of the causes refractive error, meaning one could have a very high myopia, that's short-sightedness.
One of the eyes?
Either eye.
Okay. Or
very high hyperopia, which is long-sightedness, or astigmatism. And that could make the eye, just maybe, because the refractive error is eye, and the other eye is probably a little bit of refractive error or normal. So the eye that has a very high refractive error is not seeing very well. It's not sending the right signal to the brain. It tends to, gradually goes outward because I'm not really functioning. So just go outward,
so like
or go inward.
That's
another cause.
Okay.
Yeah, following. That's another cause of strabismus, the muscle.
Okay.
So when the muscle is not aligning, one muscle, the muscle of one eye, there is something called yoked muscle in the eye. There is something called synergic muscle and all. So it's supposed to work together.
Right.
But if it's not working together, either one muscle muscle has a lax or one muscle has an excess innervation, then the eye can either turn inward or turn outward.
Okay.
So which results to squint or like that. Then it could be as a result of trauma. So for instance, children, they play a lot.
Yes.
So, when you say children, we have different stages. 1 year old, 2 year old, 3 year old. So as the case may be, if a child plays and then he or she has trauma, in the sense that
something hits
the eye, or he or she hits his or her head, it can affect a muscle, because the muscles innervating the eye, they are very, they are, let me call it, they are pathway now.
Okay.
It's very, very, the way it is in the eye, it's prone to, being affected if there's a trauma.
Oh, I have a question here. This person says, can illness in children also cause strabismus? Although the spelling of the strabismus, the person tried. Yeah, but okay, so yeah, maybe illness, maybe. I know I've heard something like that, where after someone fell sick and when the person recovers the eyes.
Yeah, in fact, even in adults. So recently I
can
had
sickness cause it?
Yes, sickness can cause
illness. What kind of, maybe brain or neurological?
Yes, we have cerebral palsy. We have hydrocephalus. We have brain tumor. Even a brain tumor can make the eye. So even a very severe sickness could result in dissociation of the muscles. So yes, so it can lead to strabismus. Though reminds me of my patient recently. Is that this one is an adult?
Okay.
So she has had diabetes for long. Okay. So she said she has not treated it for years, over 3 years. So she's not taking medication. She just left it. So that, I think she was fighting it, but she wasn't doing the proper things. Even hypertension as well. Digressed, say in the child is red eye.
Red eye.
So yes, there are a lot of causes for red eye. We have bacterial conjunctivitis. So that's the common one. That
I think that's if a child has red eye, it will be very, very noticeable, because children have mostly white eyes.
Yes.
So a child with red eye would be,
and the redness may not even be as much.
Okay.
It might even be very mild redness.
Okay.
But you notice discharge, especially if it's a bacterial. If it's of bacterial origin, so you notice those sticky discharge coming from the child's eye. Sometimes you notice the child excessive tearing. Let me not say excessive tearing, because excessive tearing now is another symptom on its own. Okay. Yes.
So it might not even be conjunctivitis.
Yeah, it might not be conjunctivitis. So also we have allergic conjunctivitis. We have viral conjunctivitis that could make a child's eye red. And now the wrong practice for some parents is to, oh, it's a baby. If it's in the case of a baby, they'll take breast milk and put in the baby's eye.
Yeah, let's talk about that. How effective is that?
It shouldn't even be an option for treating a child's eye.
Because people swear by it. I've heard someone actually, say, this thing works.
No. So for children, or generally, sometimes, even if you don't treat a red eyes, depends on the cause, it goes on, it's resolving on its own. So it is not the breast milk you put in.
So it might just be that the eye was already healing itself.
Exactly, the eye can heal itself. So, but when you put breast milk, you're introducing bacteria, you're introducing other foreign bodies that could lead to more serious problem. Reminds me of my patient too. So this
I want to use breast milk.
So this one, we don't even know what causes this one. So there are a lot of things that could cause harm to children's vision.
Okay.
Now, if a child has measles, smallpox, chickenpox while growing up, that could affect the child's vision, the child's retina. It could cause a lot of problems. In fact, if you see eyes, you know that there are problems in the vision, which I mean, some of the causes are things easily avoided, you understand? And then it's also important that once you notice the symptoms, you should take your child to the hospital immediately instead of self-treating or home
self-medication.
Exactly, because it could doing home remedy, which is very wrong, could bring about even severe, worse eye problems that when the child becomes an adult, it becomes permanent and is not treatable anymore. So I was talking about red eye, and then I made mention of tearing and excessive tearing. So when you talk about excessive tearing, there are some problems associated with excessive tearing. Glaucoma. So in children, there is
Can children have glaucoma?
Yes, there's something called congenital glaucoma. So excessive tearing is one of the signs or one of the symptoms of congenital glaucoma. And then you see the child's eye will be bulgy, will be big and slightly bluish. Okay. Yeah, so once you notice some of these signs, then you should take the child to the hospital and not ignore such signs. Then one other symptom you'll notice is a child or excessive rubbing of the eye. So there is, of course, it's occasionally it's normal to maybe rub your eye, but once it becomes constant, excessive, then
the child is always
it's a sign. Yes,
eyes,
always itching or always rubbing the eye. Then could be a problem. The child could have a refractive error, that needs correction, and some people think it's children. Don't take them to the hospital to check their eyes. They are too small to do eye tests. Some people, even when they bring the child to the clinic and you finish treating them and they've seen that the child needs this treatment or needs this pair of glasses, they are still skeptical as to accepting treatment or accepting the fact that they'll function better, help them improve. Then it's a good one, because when a child begins to develop more permanent problems such as amblyopia, so we have amblyopia, is also known as lazy eyes. So lazy eyes in the sense that because the interaction between the eyes, that eye, and a squint also could make a child tilt the head to either direction, either to the left or to the right, in order to be able to see better.
We have a call. Let's take this. I see Elder Tawagwade is trying to connect with us. Hello. Hello, Elder. Hello, Elder Tawagwade. Can you hear me? Hello. Okay, Elder. Hello. Okay. We lost that. Okay, so Dr. Rashida, please go on. Elder, please call back so we can get that call. I see Elder was at the hospital, at the clinic.
Yes, I was privileged to meet him when he came around, and he came for the book.
Elder doesn't look like his voice, so it doesn't look like his voice.
No, it doesn't. For real, it doesn't. I was happy to see him.
Okay, great. Let's try this one more time. Hello.
Hello, my friend.
Well done, sir.
Good afternoon.
You're welcome,
Good
sir.
afternoon, sir.
I'm Dr. Rashida.
Good afternoon, sir.
Thanks for that reception here on Tuesday.
You're welcome. It's nice to meet you, sir, in person.
How about my doctor?
She's fine. She's unavoidably absent.
Well done, and thank you.
Thank you, sir.
Thank you, sir. So I finally saw you. I saw you.
You made mention about hypertension in children's eye. I don't get that area clear.
Okay, so when I made mention of hypertension, I gave an instance of an adult, not a child, actually.
Okay.
Okay.
Yes.
Okay. All right.
I just want to clear that area.
That clarification. Okay.
Yes. Is an adult, not in a child. Of course, a child shouldn't have high blood pressure. Though we have juvenile diabetes, but we do not have juvenile high blood pressure.
Okay, so a quick look at the traffic situation. I see that it's a bit of a steady movement, a bit of a busy movement for those going inwards. That's on Ogudu end, but this time not away from Ifako inwards Ogudu. Now it's Ogudu inwards Ifako. There is an event at that event center. I think Fish Farm. Yes, there's an event going on at Fish Farm, and we seem to have a bit of people parking and all that, and VIPs, doing their thing, disturbing movement around that end and that's really affecting movement on that end. So as you head in that direction, just factor that into your movement. It's a busy one in what's Ifako due to an event happening at Fish Farm. A bit of a slow movement, but by and large, just keep to the fast lane. You should be fine on that end. We're talking common eye symptoms in children, and Dr. Rashida Daruno has been doing justice to this topic. All right, back to you, Doctor.
All right, so I was talking about excessive tearing as one of the symptoms for glaucoma, congenital glaucoma, that's in children. So you don't want to ignore that excessive water coming out of your child's eye. You want to take that child to the hospital to find out if it is a sign for glaucoma, or another reason could be the fact that there is a duct in the eye called the lacrimal duct. Once it is blocked, the lacrimal duct is where the tears in our eye passes through. It drains through that part. So if it is blocked, then it comes out of the eyes.
Okay.
So you want to find out if it is blocked as a result of a bacterial infection, or if it's an anomaly as a result of defect in the structure, the way the structure is formed.
Yes.
Okay, so you want to know so that you can manage properly. Also, when a child moves too close to something, whatever it is they're looking at, in order to view it, to see it clearly,
yes,
or text whatever it is they are looking at close to their face, for instance their book, or they want to go close to the TV in order to see what they are watching, then it's
what does that point to?
Oh, it points to myopia, of course. Short-sightedness.
Okay.
It also points to astigmatism.
Yes.
So it could be astigmatism, it could be myopia. Mostly it is myopia. All right. Blurry vision at near. Sometimes blurry vision at near could also result to hyperopia. Okay,
so I have a question here on WhatsApp. What can be done for a child with okay? I think this person was asking about. I think this question has to do with glaucoma. I think this person has to do with glaucoma. What can be done for a child with glaucoma?
Surgery could be done for a child.
And will the child retain his sight?
So the chances are there. Okay, when it's congenital glaucoma, it's a serious one. Okay, because of course, in most cases, you don't know. There is a way the vision of a child is measured. All right, so at certain age, a certain level of visual acuity is expected of the child. So at that point in time, all right, you can measure. The visual acuity can be measured. So it is when the child grows to, the age of being able to use an adult visual chart that you'll be able to find out, is
that
this vision
can be
good
helped
or not, and all. But well, according to you say it's a 50-50 chance. All right. So, but of course, yes, there are remedies for children that have glaucoma. So surgery can be done. Eye drops, of course, we have eye drops that could help to maintain and reduce a very high intraocular pressure in such children. Yes.
All right, please go on. So, even as we round up on the show.
All right. So one other symptom is light sensitivity.
Light sensitivity.
Yeah, light sensitivity. So nowadays you see children using their laptops, using their devices and all, and they spend much time on such devices. So you want to protect that child's eye, so that he or she doesn't develop.
So how much time on this visual devices is safe?
So
maybe per day, how many hours or how many minutes?
So you cannot say maybe this so amount of time is safe, so amount of time is safe. But if you are going to spend more than 2 hours on your screen or your digital device, then you need to protect your eyes. You need to use glasses, blue light protective glasses.
For children?
For children too, they need to use blue light protective glasses. You need to regulate the time they spend there. So they can't just spend 4 or 5 hours at a stretch. So if you spend 2 hours, you take a break, then you come back. If you have to, continue using it.
Quickly,
and then also there is...
What are the potential effects of spending too much time on visual devices? Children?
For children, they could develop dry eyes. Yes. And then research has shown that children that are always indoors, spending time on their device, are at the risk of developing short-sightedness, myopia.
Because they're always looking at...
Because they're always looking at close at a
doing
close
close
range.
work and
Exactly.
all that. Okay.
Yes. Also, they could develop computer vision syndrome, okay, which can affect their eyes as well.
Okay.
All right. So yes. So children, if they have to work on their screen, they need protective devices.
Oh, yeah, okay.
And so a child, there is no age that is too early for a child to do an eye test.
Okay.
From birth is when eye test is being carried out. You examine the child eye for any abnormality at the age before they get into school. Okay, you do eye tests. We have series of eye tests that are being done for a child. We test how their muzzle movement, how their muzzle move, if they move together, if they are right, or if there is a misalignment, if there is strabismus or squint. Also, we check for their color vision. Some children, they grow up developing color deficiencies.
Okay.
So they will be able to tell, okay, this is red color. We have red color deficiency. We have green color deficiency. So children have such as well. But if they don't do eye tests, they might not know. And when a child is saying this is black when it is red, you'll be wondering, is this child joking, or is it not? Is not serious in class, or is not a very brilliant child? So instead of doing that, why not take the child for an eye examination to determine if there is a problem that can be resolved early, quickly, so that it doesn't result into a more serious, unsolvable problem. So no child is too small to do an eye test, an eye examination. Instead of doing those remedies that could hurt the child eye, why not take the child
breast milk and all that?
Yes, why not take the child for a proper eye test, and then this problem is solved.
Great one. Why don't you take that child for an eye test? And especially at this time when it's midterm break, just take advantage of this few days we have. We still have tomorrow,
Yes, tomorrow, Saturday.
Saturday, of course, and before Monday.
Yes.
Good vision is key to a child's development and success in school. A child who does not have a good eyesight might have falling grades and low self-esteem and all that. If you notice any of these symptoms in your child, don't wait. Get their eyes checked today. For a deeper dive into this topic, do well to grab a copy of Dr. Priscilla Imade's book, Common Eye Symptoms. It's a must-read for anyone looking to detect and manage eye problems early. In case you joined the show late, or perhaps just want to watch the entire show and pick up points, when you watch it the second time, you get some things that you didn't get clearly. Kindly go to our Facebook page, Lagos Traffic Radio 96.1 FM, or check our YouTube channel, Traffic Radio 961, and search for the keywords Eyes on the Road. Our regular optometrist on the show, Dr. Priscilla Imade, who is unavoidably absent, an optometrist with a PhD in public health, a fellow of both the American Academy of Optometry and the Nigerian Optometrists Association, and a consultant optometrist at Modern Eye Care Foundation, situated at Omole Ojodu Baja, Lagos, to plot 16 to 18 Ogunusi Road, opposite Omole Estate, Phase 1 by Akode Bus Stop, Ojodu Baja. And you can reach her on 080 3333, that's 3 in 4 places, 6672 33336672. Thank you, Dr. Rashidat Aruna, for coming by, and of course we have learned so much. Looking forward to having you on other editions of the show. Special thanks to our production team led by Micah Aroncha, assisted by Olame Benita and Danon Toby. Yes, to our executive producer also, I say thank you. It's Mr. Tayo Akonle. My name is Akan Usen. Our bundles of joy, our children are on midterm break right now. Let's endeavor to show them much love by taking them to an eye clinic today for thorough examination. See you next